Burnout is a syndrome which results from chronic workplace stress that is not being successfully managed. Clinicians around the world are facing workplace stress that is mounting, and so it is not surprising that we are hearing more and more about burnout. Welcome to Reducing Risk, a series of podcasts from Medical Protection created specifically for doctors in Aotearoa, New Zealand. Reducing Risk looks at key medico-legal issues in our jurisdiction and provides helpful advice and guidance on how to manage those risks. Today we are bringing you a podcast in our Wellbeing series where we are going to discuss burnout as a continuation of our communication in conflict situations. My name is Chow Yen and I'm here with my colleague Dr. Sam King, fellow medico-legal advisor with the Medical Protection Society. Today we are very fortunate to have as our guest Dr. Ashwina Rao, who is an anaesthetist in Auckland. Ashwina has been an anaesthetist since 2003 and has undergone accreditation to train several communication models. She now does one-to-one communication training for doctors using compassionate accountability, a tool to navigate conflict and strengths, a tool to enhance performance and well-being. She has a diploma in positive psychology and well-being. Hello, Ashwina and Sam.
Hi, Chayan.
Good morning, Chayan.
Good morning. So in one of our previous podcasts, we talked about how communication in conflict situations can weigh heavily on us. And I myself often go away from conflict situations replaying what happened in my head and dwelling on it, often for days and days and days. I can imagine that if difficult conversations like advising upset patients that they have to wait a long time for their procedure, or discussing difficult scenarios with our colleagues, or dealing with angry colleagues, that these all add up and contribute to burnout. So Sam, can you tell us a little bit about how burnout happens in the experienced doctor?
Yeah, I think for the senior doctors, generally it's not just the fact that the buck stops with you, and it does, is the fact that you've got a lot of responsibilities added to that. So you're often looking after other staff, you're doing admin, you're dealing with management. So there's a lot of pressure that goes on to the senior doctors. And that combined with, just the busyness, the sheer weight of work that most clinicians are under, and the lack of resources, which is, affects both secondary and primary care. It's a lot. And often those things mean that we're working very long hours. We're not getting the downtime that we would like or need. And, for example, at home, if you've got younger children, if you've got sick parents, if you've got things going on in your own world, I think it can be hard to get a break as such. And one of the things I have noticed, we get calls a lot at MPS around resource constraints. I've had a lot of oncologists actually call me and say that, they can't bring the patients back for follow-up in a timely manner, so they're missing out on their treatments, and which leads to worsening outcome. And that weighs very heavily on clinicians. Or other clinicians who ring me and say the first specialist appointments, the FSAs, are so long. They know that people are dying on the waiting list. They know that, diagnoses are being delayed. That, if you've got a cancer diagnosis, the delay can make a big difference to that patient. And so the moral distress amongst clinicians is significant, and it's very real. We all go through med school and we all come out wanting to do a great job for our patients. We all have high standards for how we like to work. But when the system is such that we can't work to that standard, I think most of us find that very difficult to cope with.
Yeah. And I think it's helpful that people phone to talk about it. And that's one way that burnout manifests, is that people want to talk about it. And I think that's a really healthy approach. But there are other ways that burnout manifests, and it can be less constructive. So do you know of some ways, Ashwina, of how burnout can come across?
I think burnout in the experienced clinician is actually very subtle, because as you get more experienced, you become very familiar with having the same conversations to do with factual content. And so there's an element of masking that people therefore can't see.
Yeah.
So it will be quite small changes from connection to detachment. So what you might notice is someone becomes more, appears to be emotionally flat, like they're just going through the motions, just not so engaged as they were previously. You might notice more transactional communication, more that they treat patients as tasks, for example, and rather than relating to individuals. And I think the clearest signal is often that they avoid conflict. And so rather than responding, they may just become more rigid and less open. And that's really something that patients notice when the communication becomes shorter.
And we certainly see a lot of patient complaints about that, about how the doctor fobbed me off, didn't spend time with me, I felt belittled, and all of those things. They can often be a reflection of just the pressure that the doctor is under.
Yeah.
And if you think about what you're talking about, emotional exhaustion, we don't really think about exhaustion as being emotional. We think of it being as physical. But emotional exhaustion means you don't have the energy, the excess energy to have real-time conversations and respond to someone's emotions, to give your emotional part to the conversation. And unfortunately, that means that patients can leave conversations feeling that they haven't been heard or listened to. You haven't really understood what they're trying to explain to you. And that part, that listening part, those first 40 seconds where a patient expresses those things is actually perhaps the most important part of the whole conversation, irrespective of the rest of the content.
Yeah. Yeah, definitely that's where a lot of complaints come from. And actually, how we communicate with our colleagues can change if we're burnt out or if we're feeling like we're overwhelmed or stressed. And certainly there are a lot of complaints about those. Recently there was an HDC case published where the article specifically mentions burnout in the clinician. And the herald was, "Patient dies after burnt out brain surgeon ignores advice from colleagues." And that was the herald title. Do you know much about this case, Sam?
Yeah. It's on the HDC website if anyone wants to have a look at it. But there was a 51-year-old woman with prior aortic and mitral valve replacement. She presented with gastroenteritis symptoms and neurological features, including delirium and speech disturbance. The CT head showed a small intracranial hemorrhage, and the differential diagnosis included infective endocarditis, stroke, and sepsis. She underwent an endovascular procedure, and a complication occurred. She sadly deteriorated and died, and the case was referred to the HDC by the coroner. And the investigation at the HDC focused on whether it was appropriate to proceed with intervention given the intracranial hemorrhage and systemic illness, whether the procedure was performed to an acceptable standard, and how the risks were assessed and managed, and whether communication and consent were adequate. So it's quite a far-ranging investigation. And burnout was specifically raised in the case in relation to the treating clinician. And the concern was that workload and fatigue may have affected his clinical judgment and decision-making around proceeding with the intervention and managing the risk. And it was considered as a contributing factor, but not the standalone cause. So it wasn't the entirety of what happened. But that's essentially the story.
Yeah, and I think one of the issues highlighted from the case was that the staff reported that they didn't feel able to speak up about the potential concerns that the radiologist may not have been taking the right approach. And one staff member reported saying that, "Do you want to do it like that?" And they got a response that was perhaps a little bit sarcastic. And that was raised by the HDC and criticised.
You can understand if you're in the doctor's feeling burnt out. It's a high pressure situation. You've got a very sick patient. You've got whole lot of other clinicians, I expect the lead clinician was concentrating, thinking, okay, we need to do this, 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 and this, and to suddenly to find that he's questioned, probably perhaps unexpectedly,
Yes.
that you might have a short answer. Of course, it wasn't helpful. Of course, the team couldn't function effectively because people were afraid to speak out.
Yeah.
And perhaps that negatively impacted the outcome. But I can understand how the clinician at the centre of the case might have felt at the time.
Oh, absolutely. Absolutely. What you described, feeling stressed under pressure and thinking that, this is the right approach, and I believe this is the right approach. So how are some of the ways that, when I'm feeling stressed, I notice it in myself. I snap at the kids a bit more. I yell a bit more at the kids.
I can't imagine you ever yelling, Chow-Yen.
I definitely yell at the kids. But also, if I'm under stress at work, I do all those things. I withdraw a bit. I talk less. I definitely don't communicate what's causing me stress. But actually, there's been circumstances where I look back and I think, if I just said to them, I need to be away on time today, I think I would have reduced a lot of pressure on myself if I just communicated. And I think that's what happens when you feel like you don't have the resources to manage the situation, is that you withdraw.
I think our colleagues, if we said to them, I'm really struggling, I just need a bit of extra support today, that people would step in and help you. But you're right, often we're not very good at communicating that, are we?
No.
I think in anaesthesia we are lucky. We do work in a team. We work within a team of people, but we work very closely with the anaesthetic technician. So it's like we have a support person if we choose to use them. And I think the openness, I love what you said, Chow-Yen. I can definitely reflect on times where I've had a conflict at work where openness definitely would have been key to me having navigated that in a more healthy way. And the point about self-awareness, understanding yourself. How do you change? How does your communication or your pattern of thoughts change when you are feeling overwhelmed with the amount of resources you have and what's being asked of you?
Yeah.
And thinking about primary care doctors, we all work in our own consulting room, pretty much in our own little silo. And so often you don't know how the person next door in the next door consult room is coping. And as if it happens to be an inbox overflow, well, nobody notices that.
Yeah.
And I wonder that maybe it is just about us reaching out and saying, hey, look, my inbox just needs attention. I need to block out a few of my appointments so that I can get on top of this, rather than feeling like the pressure of people need to be seen, therefore you've got to see them. I think maybe that for GPs as well, we need to just be more mindful to put our hand up to say, I need some help today.
I think that in what you're saying, it's almost like you change the focus to what is the best for the patients rather than what is the best for me. Of course, they're linked, because the longer my inbox goes where it's building up, the more stressed I feel. But bringing that out into the open, I agree with you. People want to help each other. People want to support each other. And actually normalising those conversations means if I have already paved the way and said, this is where I'm struggling, can you help? You're more likely when you're struggling yourself to follow with the same openness.
Oh, absolutely. And that's how culture is established, right? And we know that because burnout is an employment issue. The culture of your workplace is really important, and it's how we can all address or help to lessen or address burnout.
The interesting part in that openness that we're describing with others, I think that has to start first with yourself.
Yes, yeah.
So for me to say, I'm struggling with this is actually quite a big challenge for many people. And if I can't do that with myself, then it's going to be much less likely that I can then bring that out into the open and say to someone else, I'm struggling.
Yeah.
And normalising that feeling, it's okay if you don't feel okay, I think is a great way to start.
It is hard though, isn't it? It's letting go of that perception that I can do everything. It's letting go of perfection to a certain degree, to say, I'm not going to be perfect with my perfect GP persona, and I'm going to say that my inbox is overflowing.
I mean, I think it's also about letting go of the idea that my sense of being valuable is only tied to my output in my job.
Yes.
It's to have some self-compassion and say, I'm important and looking after me is important. Because when I look after me, my ability and my energy, my bandwidth to do all the tasks that are important to maintain the best and the safest patient care are all linked. But it starts with ourselves.
I think too that if you make a clinical error, and whilst it's a mitigating factor, the fact that you've got burnout, the fact is you've still made an error.
Yeah.
And you're still held accountable for it. And whilst most of us will allow ourselves to be stretched to a certain point, when you get stretched too thin, the risks are not just for you, but also the patients. And I think ultimately it's better to say, I can't do all of this. I need to reduce my workload somehow, knowing that some patients will need to wait longer, but it is better to do that than to think I have to do it all.
Mm. Yeah.
There was a really beautiful podcast I listened to. I listened to the Rangan Chatterjee, I think it's called Live Well, Live Longer, or something along those lines. And he does a podcast with Gabor Mate. And it was the podcast from last year. And Gabor Mate talks, he was an obstetrician, I believe, at some point. And he talked in that podcast very openly about the feeling that he felt that he had to work all hours because if he wasn't there, then somebody wouldn't have his care.
Yeah.
But actually we all have to realise that the healthcare system goes on without us. And it's better if we're part of it, that we're at our best and we're flourishing rather than languishing.
Yeah.
And ultimately, if you burn out and leave the profession, we've all lost. You know, you've lost and we've lost.
That's right. That's right. And you know, we've all gone to places, whether it be just to the supermarket or to the library, or where you interact with someone that's an employee of that establishment, and they're really happy in their work, and you notice and you go, oh, that's a really positive interaction. I really like that shop. I enjoyed that experience. And so it's about when you're happy at work, the people around you experience it, and it's a positive interaction.
It is. You get better teamwork.
Exactly.
Better patient outcomes. Patients don't complain as much.
Yeah.
You know, because 70% of complaints have a component of communication in them.
Yes.
And if we're communicating poorly, you really are putting yourself at risk. So I agree. We need to put ourselves into a positive frame, however that needs to happen.
Yeah. And I think it's hard because it's described and understood as an employment issue, but there's all this kind of undertone and expectation that it's still up to the individual to address it.
That's right. And why don't we just touch on the organisational side? Because we do know that the bigger component is what the organisation and the culture of your place is like. Is the bigger factor contributing towards burnout. But I'm sure it's in primary care it's a little easier to change the culture. But in the hospital system, I'm sure it's a lot more difficult. But, you know, there's that saying, if the goldfish is sick, you change the water.
Yeah.
Well, some places we need to change the water.
Yeah.
And I guess it's a question of how do you do that when you don't have much authority. And I don't know whether you two have any ideas around that for the hospital system. I mean, I think there are things that individuals can do that will help. I mean, even, you know, we talk about civility and, you know, just even saying hello and thank you and calling people by name and looking people in the eye. All of those sorts of things create a culture, don't they? And it's small and doesn't cost us anything. And even things like, you know, buying somebody a cup of coffee, you know, makes a massive difference to what you can do amongst your team, or just, you know, you look a bit tired today, do you want me to help you? Is there something I can do for you?
Yeah.
Creates a culture of that. But if you think about the wider culture, and we think about, the whole resource constraint, for example. Golly, I mean, I don't know that anybody's got an answer for that.
No, but the regulators, they have started asking, haven't they?
They have.
They have said, what's the name of your service operations manager? Have you raised your concerns with your managers? And who did you write to? And can you show me that correspondence? And then they start asking the services. And a lot of HDC criticisms certainly are directed at the organisation and at the system, and they very much make systems recommendations.
They do. They do a lot more. I think the HDC are very cognizant of the resource constraint issues within hospitals and take that into account. But Ashwina, do you have any ideas about what hospital clinicians can do to perhaps shift the culture in a hospital or the expectations of management? There might not be an answer to that. I'm just asking.
I'm not sure on a hospital-wide level, but certainly on an individual departmental level, having the openness to discuss with your head of department where you are and what you need. Because some of the things I learned in my positive psychology diploma were autonomy, relatedness and meaning are some of the key protectors. So autonomy, I think, in medicine, in the public system, is probably relatively low, depending on your specialty. Time structure, how are you doing what and when?
Yeah.
In anaesthesia, in our department, at least, we're very lucky. We have an app that allows us to see our schedule weeks in advance. We have the ability to plan leave 6 months in advance, so that we have an idea of when we can take leave, so constructive breaks. The other idea that I really enjoyed in positive psychology is the idea of life crafting. And you can apply that to job crafting, really. One simple way we assessed this in our diploma was to use an app. I think it's called What We Feel. And it's an idea that you, every 2 hours for 2 weeks, you do a check-in. How do you feel? You write a little note about what you were doing at the time. Look for keys and sequences. Then have an idea over time. What is draining me? Which aspects of my work are really overwhelming me? I have been fortunate in that way. I really enjoy things that most of my colleagues don't like doing, which is the pre-assessment clinic. I find I get a lot of energy from that. And it gives me an ability to recharge my batteries. You can job craft in other ways, in that you can try to redo your schedule, which might give you lighter weeks and heavier weeks.
Yes.
It might give you a different way of working. It might mean that you need to temporarily drop your hours. It might mean that you have to drop the call for a little while. But all of these things really are ideas that you have autonomy over the way you work. And I think that small changes can actually have a really big impact on your ability to feel that you're managing.
I think that's a great idea. I mean, you mentioned about you like the pre-assessment clinics and you feel recharged. I think if we look for those things, what recharges my batteries within my work environment, and why don't I just do more of that?
Yeah.
Because you're right, there's so many different people and personalities. There's bound to be a spread. I'm sure the others who don't like doing pre-assessment clinic, I think it's fantastic. Ashwina's going to do my clinic for me.
Yes.
So it's a win-win for everybody.
How did you know?
Oh, yeah, we often get in our WhatsApp chat, anyone want to do my clinic for me this afternoon?
Ashwina? Yeah. No, I think it's a great thing to do. And so, for hospital doctors, if you can possibly do that, why would you not?
Yeah, find something that you enjoy.
And that takes a conversation, doesn't it? It just takes a conversation within your department. Who likes to do what? Who needs to have time off to go watch their kids play soccer or something, or whatever it is. And it's about swings and roundabouts. We all help one another. Can make a big difference.
Yeah. And if you enjoy education, there's lots of people in our department who enjoy education, and they focus some of their clinical time in medical education, and that clearly recharges their batteries.
That's great.
So if you think about it also in a strengths based approach, the idea of a strength is a skill that we are good at, that we use often, that gives us energy. And there are things that if we are good at them, sometimes they give us energy. So it's wise to use them variably.
Yeah.
Ideally, we don't want to be using too many of those in doing what we're doing.
Yeah.
For me as an anaesthetist, it's advantageous to have strengths in planning, in detail and organisation. But I may not be very adaptable, which means I don't like to be changed around, moved around, or I may not have very much feeling that I can do action, or I may not be very reflective. And having an idea of what those things are can be really valuable. Even on a departmental level, bringing out people's strengths and enabling people to focus some of their time on things that they really love will probably overall improve your, departmental performance.
Yeah.
You only need 20%.
Yes.
That's what the studies show. 20% doing what you love at work is enough to help prevent burnout.
That's so interesting.
It is. It's good, isn't it?
And the other thing I read recently, which I really enjoyed, is that if rather than looking for things that you love, you have to change the relationships with the things that you're already doing. So how am I approaching this list that I don't really enjoy? What subtle way can I change, or what can I reframe to help me enjoy it? What can I focus on?
Yeah.
And that can also be a very powerful shift.
Because there's the 80-20 rule, Sam, as well.
Yeah. It came out of last century, and the rule is that if, let's say, you're sitting some exam, and in order to get an 80% in that exam, it takes roughly about, let's say, 20% of time. But if you want that last 20% to get the A+, it'll require another 80% of work. So the biggest wins come with the first 80% in terms of time and efficiency. And so a lot of the things we do, 80% is fine.
Yeah.
If you're writing a presentation, how much do you faff over things that nobody will even notice?
Like the references?
Like the references or pretty pictures or, things like that. Or, I know in primary care, a lot of female GPs go back and correct spelling mistakes.
Oh, in their notes.
In their notes. And it's like, why? I understand perfectly what you mean, spelling mistakes and all, so don't worry about it. But a lot of women in particular will go back and correct it. It's not necessary. But some things we really do need to get 100%.
Oh, of course.
Procedures and all of those, of course. But there are lots of things we don't. And it'll save you so much energy if you just think about 80% is good enough for this.
The department's dishes can stay in the sink.
They can. Or I didn't clean it quite thoroughly, but that's okay. No one will die.
As long as you have a cup to drink your coffee from. What other tips do we have for avoiding burnout? Letting go of perfectionism?
Yes. So many of us are perfectionists, aren't we?
Yeah.
And the thing is that it just becomes such a driver in us. I think, unfortunately, with those of us that are perfectionists, it's that little niggle. If it's not 100%, we niggle over the 1%.
Yes.
And that can soak up time and energy where it doesn't need to. I don't think it's easy to give up perfectionism, but it's possible, I think, to do it. And I've naturally been a bit of a perfectionist myself. I consider it I'm a bit of a failed perfectionist because I won't start if I don't think I can get it do it really, really well. But I've spent a lot of time telling myself that I give up the right to perfection.
Yes.
And, just getting that ingrained into my thinking so that I can relax, even if it's not 100%.
And even with our patients, if you don't communicate perfectly the first time, there's still the opportunity to go back to them to say, I'm really sorry I came across that way earlier. I didn't mean it like that. So it's not fundamental to doing our jobs, perfectionism.
I remember speaking to a couple of eye surgeons in one of my workshops that I took on burnout, and for them, they said that's the problem for them, is that people want perfection in terms of they want to be able to see 20/20.
Yes.
They don't want anything less.
And they don't want to wear glasses.
They don't want to wear all of those sorts of things. So it's extremely difficult in terms of, their clinical practice. And I guess if you've got a specialty like that, you need to think about, well, where else can you let go? Where else can you just relax and draw outside the lines?
Yeah.
And maybe it is about finding things in your recreational time where you can do something different, completely different, and be creative. Creativity requires drawing outside the lines. And it's just something completely different to the precision of operating. And so think about what you're doing in your other world.
Yeah.
I had a very stressful year one year, and I took up guitar.
Oh, yes.
And I've tried many times over my lifetime to learn guitar, and I've always petered out after a few months. But this time it really stuck, and what I found was that it was just such good mindfulness for me. Learning an instrument, whilst I didn't sound necessarily very good, it didn't matter. I'm only playing for myself, and I enjoyed it. And it was so good for me that my husband would often say, "Why don't you go and play your guitar now, Sam?" And he used to say to me, "I think you need to go for a walk now or go for a run." Because those are the things that build me, and I always feel better after those things. And so, I think all of us need to have that in our lives.
Yeah.
What is it that fills your bucket outside of work? Because we need recovery time.
Yeah.
And I know it's hard when you've got people demands outside of work, families and, whatever. But it's very important so that you can be the best you need to be for those people.
And even if it's just going for a walk when you can for a couple of minutes.
Yes.
You might be in theatre all day, or you inside all day. But I was saying in one of our other podcasts that I had a colleague who would disappear for 5 minutes in between cases, and he'd be outside feeding the ducks, and then he'd change and come back into theatre.
Yeah. No, I mean, there's studies that have shown that that's really important. Every 60 to 90 minutes, you should take a break, however short, whatever that break looks like for you. I've spoken to some doctors, they will do some of their inbox. I'm not sure how that can be recovery time, but that's what they do. Some people it might be, I bet a lot of us are just dehydrated at work.
Yes.
Sometimes it's just about having a drink of water.
And going to the bathroom.
It's those sorts of things. If we can do that regularly through our day, just these very short, brief moments, it can really make a big difference in terms of our overall energy and performance.
I love the idea. We should approach our head of department and ask for breaks every 60 to 90 minutes during our theatre day. I love that.
Yeah,
Time
it
to
might be
feed
hard.
The ducks. There you go.
Yeah, it might only be 2 minutes, right? It might only be just a brief moment in time. Like, for example, you're in clinic. Do you take a moment before you get the next patient in? Do you just take a minute to do something else? Stand up, do some squats, I don't know, whatever that happens to be. It's only 1 minute. I know it can be hard to do when you've got a waiting room full and you're running late, but boy, it can make a big difference to how you present to your next patient.
Yeah, absolutely. Absolutely. Have we touched on how to escalate your concerns if you're concerned about your system?
No.
So I think we should talk about that because, with our resource constraints, it's happening a lot. And the Medical Council has a statement on practicing in a resource-constrained environment. And like we mentioned earlier, the HDC does ask for the names of the service directors and what's being done to assist with your service. And I think that's really important. If you've got worries and if you've got concerns, like many of us do, it's about putting it down in an email and sending it to the right people And if you don't get the appropriate response, you escalate. So it goes from the service manager, next it might be the operations manager, and then CEO all the way to the board.
Yeah, I often talk to members about this, putting it in writing. And sadly, what a number of them say to me is they've already done that and they get no response. Nobody responds to them.
Yes.
And so my advice is it might not feel better at all from your perspective, but from a medico-legal perspective, it protects you when something adverse happens. And the HDC are very good these days with looking at resource constraints. And so if they know that a lot of it's to do with resource constraints, they will find the entity, the hospital, in breach of the code and not the individual clinician. And whilst you might still have a poor patient outcome, at least you know that it was because of the system that something didn't happen. And I think that's the best you can do. It's not ideal. I guess the other thing too is whether you contact ASMS, your union.
Yeah.
They might step in and be able to do something. But there's not a lot else, I don't think, beyond that in terms of escalation points.
So we've covered a lot today about burnout. It's a big topic, and I think it's an important topic that affects so many of us. Do either of you have any final comments for me? For our listeners?
I would say that, you as an individual are really important. That the hospital system, the health system cannot function without healthy doctors, healthy clinicians. You are really important, not just for the hospital system, but for your family, for those around you. And so to look after yourself, I think, is an important priority that perhaps we need to pay more attention to, particularly as senior doctors. And there's no shame in that, because you'll find that so many of us are in the same boat. There is such a high rate of burnout amongst clinicians that you're actually in good company. So there's no shame in it whatsoever. But doing something early is really important, to stop that slide. And so my encouragement to clinicians is to reach out. Just put your hand up and say, hey, I need help here.
Yeah. I think being an anaesthetist, there is that terrible sadness for our profession that, physician suicide is certainly something that comes up for us. And I think we need to acknowledge that we are here for each other. And even if it's the person next to you who just says, do you need a break, or can I help with something? It's a workplace issue, so we're there for our colleagues.
I'd like to add that it's okay if you don't feel okay. If you can notice it within yourself, that your pattern of communication is changing, your pattern of thoughts is changing, that you feel like you don't care as much, you don't have to label it as burnout, but you can label it as an opportunity to seek some help. And there are so many great resources. We can access psychologists on our CME.
Yes.
There are coaches for doctors that can help us through challenges of navigating our daily work, or, bigger things that are going on if we've taken on leadership roles. And really normalising those conversations. If you notice that in one of your peers, that they seem to be a bit short, that they seem to have become a bit withdrawn, feel open to say, I've just noticed that you seem a bit different lately. Would you like to talk about it? Are you okay? Do you need any more support? Because as you say, we are all better together. And the sad reality of physician suicide is definitely something we have to be aware of.
It's probably not a light note to finish on.
Yeah.
But, I've had two members commit suicide as a result of the process they were going through.
Yeah.
And so I guess the main thing is don't underestimate the difficulty that we all face when we have a complaint or an HDC process or medical counsel process, that you would be pleasantly surprised, I think, how your colleagues will rally around you.
Yes.
And how common what you're feeling is amongst all of us. That because if we don't talk about it, that's why we don't know about it.
Yeah.
But obviously you and I get to speak to a lot of doctors who are under a lot of stress, and you'll find that we all react in very similar ways. And so please do reach out.
Yes.
And look, we at MPS are very happy to speak with you if you're struggling with anything. And to be able to, even though we might not be able to give you counselling ourselves, we might be able to point you in the right direction and provide you with some support, particularly if you're going through a complaint. We walk through the most difficult of situations with our members.
Yes.
So reaching out to us early is important.
Yeah, thank you, Sam and Ashwina, for joining me today. It's been really helpful to talk about burnout, and I do acknowledge that we probably didn't end on the brightest of notes, but I think it's a really important note to finish on. If you are concerned that you're suffering from burnout as you're listening to us, or if you feel you're not coping at work, or if you just like to talk, please seek help from MPS like Sam's just talked about. You can talk to your GP. Please see your GP. Also, MPS has a counselling service which members can access by calling 0800 22 55 677. If you enjoy our podcasts, please subscribe and like them. If you have any suggestions for other podcasts or helpful feedback, please email us at nzpodcasts@medicalprotection.org.